Hi, it's Jamie Blazinski, neural retraining specialist, here with Dr. Pisano from Mast Advanced Diagnostics. We're going to be asking her some questions this week to help patients that have a lot of questions about coronavirus. So, Dr. Pisano, first question. We hear in the media that COVID-19 can be mild for some individuals, but in others, it can be deadly. What influence does mast cell activation syndrome have on this risk?
So that's a really good question. And there's a lot of unknowns, right? This is a brand new virus. It's novel, meaning it's mutated into something new and different that our bodies really don't know what to do with it. And we know there's some predisposing factors. I mean, certainly asthma is one of those factors, heart disease, diabetes, right? These are large populations where we can say, okay, well, when we see this kind of patient, we definitely see worse chances. Certainly age, the elderly are at greater risk, but we are seeing it in other populations as well. Now, I see a lot of mast cell patients in my practice. I mean, predominantly, most of my patients have a mast cell disorder. I certainly have a few that don't, but most do. And I have a lot of people who unfortunately have gotten COVID-19. So, we're unfortunately heading towards that 30 mark in the practice already. And the good news is I'm not seeing mast cell, meaning that my patients are on respirators in hospitals. So that is the really good news about it. However, what we do see with viruses in general, and not just COVID-19, is that they actually suppress the enzyme histamine methyltransferase that breaks down histamine. It's one of the enzymes, it's not the only one. That's why a lot of times if you have a patient, let's just say a basic patient that has asthma, and they get a cold or the flu, a lot of times it will worsen their asthma, and that's the mechanism. So what I am seeing in my mast cell patients is that maybe they're not getting COVID-19 symptoms that are worse than the average person, but it's aggravating their mast cells. So what I've been having my patients do is take whatever rescue med, Benadryl, hydroxyzine, Ativan, these are whatever you and your physician have worked out, and having them take that every 4 to 6 hours. Now, clearly, Ativan, benzodiazepines, we don't want to be taking those every 4 to 6 hours. We may need to work with our medical providers to create a better plan if you do get sick. But certainly Benadryl or hydroxyzine, these sorts of things are safe to take. And what we are trying to do is prevent the reactions from ever occurring by keeping our histamine well controlled. So if we do that, what I'm finding is that people aren't having those massive histamine reactions, and so it's not exacerbating things. By and large, my patients are doing well. I mean, I've had 5 patients made a complete recovery already. I've not had anybody who's required any kind of long-term hospitalization. Thankfully, nobody's on vents, knock on wood. Hopefully this continues, but I'm not seeing mast cell as this, certain death kind of thing. A lot of patients do have immunodeficiency issues, and I would say if you've been on IVIG for either some sort of immunodeficiency, and certainly if you have neurological doses of IVIG, that might actually confer some extra protection for you. But it's certainly not going to be good if you do have a non-treated immunodeficiency. So if that's the case, then you want to get with your immunologist right away at the earliest signs of COVID-19, which for a lot of people aren't aware of this. If you lose your sense of smell and taste, that is a strong symptom of COVID because of the way it uses up your zinc, and zinc deficiency will cause that. So do check in with myself if you're one of my patients, and certainly anybody else that's on your care team. So that is a really important one. A lot of my patients also have a mannose binding lectin deficiency, which is a type of immunodeficiency that impairs our complement pathway. A lot of them get more frequent infections, and they're wondering where they fall into the mix. It doesn't really affect so much. I mean, you still have 2 other pathways using immunoglobulins, and then things like white blood cells and mast cells to get into complement pathway. So you're about this much compromised. It shouldn't be a be all end all. It's not going to cause cytokine storm for you. You might be more likely to get the infection. It might take a little bit longer to clear, but really the big problem with COVID-19 is that it's suppressing white blood cells, particularly your monocytes and natural killer cells, which really have nothing to do with mannose binding lectin. lectin deficiency, thankfully.
Excellent. That's really good information. And I think that's going to be really helpful for a lot of people. Thank you for your time, Dr. Pisano.
Absolutely. And, for anybody who has specific questions, don't hesitate to contact us, myself or any member of my team. We're all here to support you during this horrible pandemic that we're working through. Thanks so much.